Before using Epipen Auto-Injector, make sure to read the instructions provided by your pharmacist. Keep the auto-injector with you at all times and ensure that it comes out of its carrying case easily. Check the solution in the product for clarity and any signs of particles or discoloration. If the solution is cloudy or discolored, do not use it. It's important to learn how to properly inject this medication ahead of time, as different brands may have different directions for use. Also, make sure that someone else knows where you keep the medication and how to use it in case you are unable to do so yourself. The dosage of Epipen Auto-Injector is based on your medical condition, weight, and how you respond to treatment. Inject the medication into the thigh as directed by your doctor and the manufacturer. If needed, the medication can be injected through clothing. After injecting Epipen Auto-Injector, seek medical help immediately and inform the healthcare professional that you have given yourself an injection. You may need another dose if your symptoms do not improve or if they return after the first dose. It's important to avoid injecting this medication into the hands, feet, buttocks, or other areas of the body. If this happens accidentally, seek medical help right away. And for infants and young children, make sure to hold their leg firmly in place before and during the injection to prevent injury. Properly discard the injector after use. If you experience fast or pounding heartbeat, nervousness, sweating, nausea, vomiting, trouble breathing, headache, dizziness, anxiety, shakiness, or pale skin, tell your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Most people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience irregular heartbeat, signs of infection at the injection site, such as redness, warmth, swelling, or pain, chest pain, fainting, vision changes, seizures, or confusion. If you notice any other effects not listed above, it's important to speak to your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or you may report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or you may report them to Health Canada at 1-866-234-2345. Before using Epipen Auto-Injector, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to sulfites. It's important to use this medication during an emergency, even if you have a sulfite allergy, as epinephrine can save your life. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have heart problems, high blood pressure, thyroid disease, or diabetes. This medication may cause dizziness. Avoid alcohol or marijuana as they can increase dizziness. Do not drive or operate machinery until you can do so safely. Limit alcoholic beverages and consult your doctor if you are using marijuana. Older adults may be more sensitive to the side effects of this medication, especially a rapid rise in blood pressure. If you are pregnant, you can use this medication the same way as if you were not pregnant. It is unknown if this medication passes into breast milk, but it is unlikely to harm a nursing infant. Consult your doctor before breastfeeding. When using the Epipen Auto-Injector, it is important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider to ensure the safety and effectiveness of your treatment plan. If someone has taken too much Epipen and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help immediately. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an Epipen overdose may include an irregular heartbeat, fainting, changes in vision, confusion, and seizures. Remember, it's crucial to seek medical attention right away if someone has overdosed on Epipen. This medication is used in emergency situations to treat severe allergic reactions, anaphylaxis, to insect stings or bites, foods, drugs, and other allergens. It is used in people who are at risk for or have a history of these reactions. Epinephrine acts quickly to improve breathing, stimulate the heart, raise a dropping blood pressure, reverse hives, and reduce swelling of the face, lips, and throat. The Epipen Auto-Injector is used to treat severe allergic reactions, including anaphylaxis. It delivers a single dose of the medication epinephrine, which helps to relax the muscles in the airways and tighten blood vessels to improve breathing and increase blood pressure. This can help to reverse the symptoms of a severe allergic reaction, such as hives, swelling, and wheezing. The Epipen Auto-Injector is typically used in emergency situations and should be carried by individuals with a history of severe allergic reactions. It is important to use the EpiPen as soon as symptoms of a severe allergic reaction occur, and seek medical attention immediately after using it. Make sure to store your Epipen Auto-Injector in the carrying case or original packaging at room temperature, away from light and moisture. It's important to avoid extreme heat and cold, so don't store it in your vehicle or in the bathroom. And remember, don't refrigerate or freeze it. Check the expiration date from time to time and visually inspect the product for any particles or discoloration. If you see any, replace the unit before it expires. And as with all medications, keep it away from children and pets. When it's time to get rid of your Epipen Auto-Injector, don't flush it down the toilet or pour it into a drain. Properly discard it when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.